Today's topic is about rights of a patient. Previously, we have seen that rights and responsibility of a doctor. Same way, today we will discuss various rights of a patient. So, first, a patient has the right to be treated with courtesy and respect, with appreciation of his or her individual dignity, and with protection of his or her need for privacy. A patient has the right to a prompt and reasonable response to question, requests, and queries to the healthcare provider. A patient has the right to know who is providing medical services and who is responsible for his or her care. So that all are the rights to a patient. A patient has the right to know what patient support services are available for that particular healthcare provider, including whether an interpreter is available if he or she does not speak English or vernacular language. So it is for the betterment of patient as well as for the doctor. A patient has the right to know what rules and regulations apply to his or her conduct. Further, in these rights of patient, a patient has the right to ask about information concerning diagnosis, planned course of treatment, alternatives if there is available for the treatment, risk and prognosis of the disease. A patient has the right to refuse any treatment except as otherwise provided by law. Particularly, patient can refuse if they are not interested in particular treatment, but if there is a for the benefit of society, patient have to take that particular treatment for the betterment of society as well as betterment of him or her. A patient has the right to be given upon request full information and necessary counseling on the availability of known financial resources for his or her care. So that is basic right to know about the financial resources which are available for that particular healthcare provider. Further, a patient who is eligible for Medicare has the right to know upon request and in advance of treatment. So, whether the healthcare provider or healthcare facility accept the Medicare assignment rate, because sometimes there is a controversy developed after the taking of treatment whether that particular healthcare facility is not accepting Medicare. So, it is better to ask in advance about that Medicare facility. A patient has the right to receive upon request prior to treatment a reasonable estimate of charges for medical care. Sometimes it is not possible to exactly estimate charge, so approximate or reasonable estimation of charge should be asked, and that is right to receive by that patient. Further, in these rights of patient has the right to receive a copy of a reasonably clear and understandable itemized bill, and upon request to have the charges explained. So what are the bill that all can be asked in detail by the patient, and that is basic right of a patient. Patient has the right to impartial access to medical treatment or accommodation regardless of race, national origin, religion, handicap or source of payment. So any patient that can ask for that impartial access to the medical treatment. A patient has the right to treatment for any emergency medical condition that will deteriorate from failure to provide treatment. So in emergency, patient can ask for the treatment to the any medical or healthcare provider. Further, in these rights, a patient has the right to know if medical treatment is for purpose of experimental research and to give his or her consent. Or sometimes patient is not willing to give information, then they can refuse to participate in such experimental research. Patient has the right to express grievance regarding any violation of his or her rights through the grievance procedure of the healthcare provider or healthcare facility which served him or her, and to the appropriate state licensing agency. These all are considered as a basic rights of a patient. So that's all about rights of a patient. So patients should take care of that rights and they can take advantage of that rights.